Maar dit lyk vir my ons het dan nou ons volgende gas, so die Dieetkundige Omy Naidoo kuier vanoggend saam en ons gesels oor hoe diabete hulle eetplan moet aanpas nadat hulle die Covid-19-inenting gekry het. So good morning Omy and welcome to the program.
Good morning to you and your viewers, and thanks for having me on.
Now, Mr. Naidoo, discuss the impact COVID has on the human body from a nutritional perspective, please.
Okay, so COVID, like any other virus, increases your body's nutritional requirements. But on the other side of the spectrum, the symptoms of COVID-19 tend to decrease the patient's oral intake. So when I talk about the symptoms, I'm talking about nausea, vomiting, diarrhea, severe loss of appetite, as well as abdominal discomfort. So on one end, the body requires a lot more, but on the other end, the patient often doesn't take in enough. The net effect of this is that you tend to lose a lot of muscle, it reduces your immune function, and overall you have deficiencies in your micro and macronutrients.
Mm-hmm. And how does nutrition help to avoid risks of complications of COVID-19?
So we've got to understand that inflammation is the marked characteristic of COVID-19. So you may hear in the media the word called cytokine storm, which basically implies that there's a lot of inflammation going on in a COVID-19 patient. So from a dietary perspective, inflammation is part of the normal immune response, but when it's exhausted, your body doesn't have enough of these anti-inflammatory mediators. So simplistically put, your diet, if you were to have an anti-inflammatory diet, this could help to improve your immune response and help to reduce your complications with COVID-19.
Mm-hmm. Now, is it safe to take health supplements while undergoing COVID treatment?
Yes, so a lot of the times, because as I mentioned in the first point, you end up having a lot of micronutrient deficiency. So when I talk of micronutrients, we see that vitamin D is quite low, various other things like selenium, zinc are also low. So a lot of the times patients it's very safe to have these, but the better approach, as opposed to just generally supplementing everything, you've got to rather do a blood test and identify that you're deficient in certain things. But one of the key ones that's definitely being supplemented on a prophylactic level is vitamin C at 1,000 milligrams, vitamin D as well. And if you're looking at things like zinc, selenium, fish oils, all of these play a role in the immune response. So it makes sense that if your body is deficient in this, to then replenish in this time.
Omy, please just elaborate a little bit more and please share your opinion regarding the importance of paying attention to a diet in this case.
Are you talking in terms of COVID-19
yes.
Compliance?
Yes.
So it becomes extremely important. If you can imagine that in this time where your body's needing this fuel of protein, carbohydrates, fat, but also having a higher requirements for special vitamins and minerals, if you're not giving your body this adequate fuel, you're not going to be able to have a fighting chance in terms of good recovery from COVID, but also shorter recovery time, a lower rate of actually being hospitalized. All of this is helping your body to improve your immune response.
And what tips can you provide to people suffering from chronic diseases such as sugar diabetes who are recovering from COVID-19?
Okay, so there's three factors to take in here. Is firstly, the treatment of COVID-19 is with steroids, and the side effect of steroids, even 6 months after starting it, is that you can actually have weight gain as well as poor diabetes control or sugar levels. The second thing is that due to the various lockdowns and limitations we have, all diabetics or all of the population have reduced activity levels. So on one end, you're still eating, a fair amount of food, but we're not exercising as often as we should. So then that can increase your blood sugar levels. And then the third factor is emotional eating. We know that mental health in this time is spiking and really becoming a big issue. And what I'm seeing in my practice is a lot more emotional eating. So when you're emotional eating, you're not going to be having a salad. You're looking for something high fat, high sugar. So those three factors contribute to very poor diabetes control. And it becomes even more important for diabetics to have good sugar control by making sure they comply with what we call a low GI diet. So anything white, so white bread, white rice, white pasta, swapping for the brown variant. and also trying to have a lot more fresh fruit and vegetables in their diet, as opposed to having the highly processed snack items and desserts that we're normally consuming in the winter months.
Well, I still have a couple of questions left, so yes, we'll continue this discussion in a short while. So jy kan gerus ingeskakel bly vir die res van hierdie gesprek. Die dieetkundige Omy Naidoo kuier vanoggend saam en ons gesels oor hoe diabete hulle eetplan moet aanpas nadat hulle die Covid-19-inenting gekry het. So Mr. Naidoo, thanks again for joining us this morning. I would like to ask you, what foods should people who are vaccinated eat to keep their immune system in order?
Okay, so the type of diet that would be helping the immune system is pretty much universal, whether you're vaccinated or not vaccinated, whether you have an immune suppressive condition such as cancer or HIV or you don't. And that is the anti-inflammatory diet. So if I could share what that means, it basically is lots of brightly colored fresh fruit and vegetables. These are very high in antioxidants, and antioxidants play an important role in the immune response. So that's the first one, fresh fruit and vegetables. The second would be to try and swap out red meat in your diet or reduce your red meat intake, because this has been shown to definitely reduce your immune response. So swapping out red meat for things like fish, and we know that fish are high in omega-3, and this has been shown to also help your immune function. The next thing would definitely be lots of your brown grains. So a lot of studies have been done, and glycemic index, which is basically how much a food increases your blood sugars, so things that are high GI push up your sugars quickly, things like white bread, white pasta, white potato, cool drinks. These high GI foods have been shown to weaken your immune response, and the converse of that, meaning a low GI diet, can help to improve the immune response. So if I'm looking at it, we're thinking of things like brown bread, brown rice, brown pasta, and also trying to incorporate a lot more beans, peas, and lentils in your diet. So just to recap on that, fresh fruit and vegetables, the brighter the color, the better. A lot more fish, trying to have a lot more brown grains, and having plant-based proteins, so beans, peas, and lentils. Sorry, that was a mouthful.
Okay, and then are there any other tips that you can provide? I know we've referred to some tips that you've shared, but maybe there's something else that we also need to know about, when suffering from chronic diseases such as sugar diabetes, that you can share, overall, in an overall perspective.
Okay, so something I advise my patients a lot of the time is, if you think of the game of darts, if you did not know where the bullseye is, you're very unlikely to win that game versus somebody else. So in the same analogy, with diabetes, 50% of getting your diabetes under control is adequate testing. So testing your blood sugar levels, so making sure you have a glucometer, but also understanding what are you testing. A lot of the time patients tell me, I test the same time every day. The important thing is to see your blood sugar levels at different times in the day. So for instance, you have two types of blood sugar levels, your fasting, which is obviously without eating, and the second one is your postprandial or after meal sugar. When we're looking at your fasting, that needs to be below 7. And when you're looking at your 2 hours after eating, that should be below the 8 to 10 range. If you're having sugar levels that are higher than those two, we need to then look at the type of medication you're on. Does that need to be increased? As well as start to identify through a food diary what types of foods you're eating, and specifically the carbohydrate portions. So that's your bread, rice, potato, pasta. How big is it, and is that adequate to cover your sugar levels?
Now, you've referred to 3 specific factors that we need to keep in mind a little bit earlier. So I want to ask you, do you think that people are aware enough when it comes to these 3 factors, and what more can be done to make people aware?
I think, there's a lot of information out there at the moment, and, a clear example is looking at the vaccination drive. The uptake is nowhere near where we need it to be, and that is just due to the fact of the large amount of misinformation amongst the public. And so to answer your question, I don't think there's enough information ever about, these medical conditions. And a lot of the time, the information that is accessed by patients is through social media and not always valid. So any interview I normally do is to always encourage anybody listening, if what we're talking about is something that interests you, rather reach out to a clinical dietitian. There's an abundance both in the private and the state sector, and we are trained to help decipher, what is fact, what is fiction, but also trained to try and formulate an individualized plan for you, as opposed to trying to, do a generalized sort of shoot in the dark approach. Why not try something that's tried and tested and is backed on scientific information?
Mm-hmm. And then when it comes to emotional eaters, I mean, I think, especially, when we look at times that we are finding ourselves in at the moment with the pandemic and everything, I think that it's quite natural for people maybe to feel a little bit more emotional and then maybe eat a little bit more. But are there any alternatives that you can point out at this stage that might be a little bit healthier?
So if you're looking at it, there's no doubt. I just did a talk last week. It was to a large group of ladies, and it was for Women's Month. And it was along the lines of also touching on, after COVID, how does mental health look? And the studies show very clearly that anxiety and depression is definitely increasing due to this pandemic. But what's important is to also note that the comfort eating is significant. And whilst it's almost difficult to avoid it, we've got to understand what is the trigger. So it means you've got to uncover what is the trigger to the actual anxiety or depression. A lot of the time it could be fears regarding health. And a lot of the time psychotherapy seems to be a good approach to try and avoid or improve those thought processes so that you don't end up with the same sort of pattern of where you feel a certain emotion and that triggers an unhealthy eating pattern. Just interestingly enough as well, there's been studies that showing that glycemic index, which is what I spoke about earlier, so high GI, meaning lots of carbs, lots of sugar in a food item, that actually has been shown to increase anxiety symptoms, and low GI foods, on the converse, has been shown to actually reduce anxiety and depression symptoms. There was a study done a few years ago called the SMILE study, and it was very clear to see that even the anti-inflammatory diet was clinically shown to reduce depressive symptoms. So meaning, whilst we emotionally eating, we tend to eat the wrong things, and then it's a cycle. Then those wrong things also then worsen our mood, increase our anxiety, and then so the cycle continues. So what's important is to identify when you have those emotions, but also to be very cautious as to what you keep around in that time. It's called mindful eating, and being aware of what you're actually choosing to eat or drink when you are feeling those emotions, because it is completely a cycle, and it continuously goes on for most patients.
And then what tips can you share when taking a look at the average person and a balanced diet?
So I often do these interviews, and I just use one word. A more natural, holistic diet would be something that you should think of. So anything out of a box or a can, we've always got to be mindful of processing. We've always got to be mindful that a lot of the time there's preservatives. The good parts of it are extracted, so lots of fibers removed. So trying to have a more natural diet is going to definitely improve, but also thinking of plant-based eating. So we know that there's definitely a trend of vegan or vegetarian eating, but the data is astounding to look at how much of clinical conditions could be reduced or improved or reversed by plant-based eating. Mm-hmm. Very often I sit with patients, and the one thing as South Africans is that we have an extremely high intake of red meat in our diet. This then corresponds with cardiovascular disease, cancer, diabetes, and various other inflammatory conditions.
Mm-hmm. Lastly, do you think that this type of information could be included on a greater scale when it comes to schools, and learning programs?
It's quite interesting you asked that. There was a study published by WITS a few years ago, and what they found was that, so it compared South African kids to kids in the rest of Africa. And what they found was that South African kids' BMI was growing between 3 to 5 times higher in that 10-year period versus the rest of Africa. But also South African kids were consuming the most in terms of fast foods and sugar-containing beverages. So overall, that's telling us in time to come, it's setting us up for a huge burden of disease from obesity. So to answer your question, definitely we need to get into that fundamental level of primary schools, high schools, and try to incorporate, as you have life sciences and life orientation, there should be components of healthy eating and generalized how do you take care of your health.
Mr. Omy Naidoo, thank you so much for your insight.
Thank you for having me.
Dit was dan Omy Naidoo, die dieetkundige wat vanoggend by ons aangesluit het vir hierdie interessante gesprek. Jy kan ingeskakel bly vir jou 7 uur nuus en weer net na die breek. Kom ons gaan groei.